Today, in the news and in everyday conversation, health insurance companies are mostly lumped together, as if we were all the same, as if there was no way to distinguish one health insurance company from another. But WPS Health Insurance is not your typical health insurance company. WPS has made its name not just by selling insurance, but by transforming the health industry. Over and over, time and again, we've pioneered new solutions that have set a higher standard for others to follow. We started out different by necessity and remain different by design. On the heels of World War II, an urgent health crisis gave rise to Wisconsin Physician Service. Thousands of brave Wisconsin soldiers were returning home wounded and in need of medical care that they could not afford. The Wisconsin Plan was developed to protect soldiers and their families from stacks of medical bills and looming financial devastation. And a nonprofit insurance company, WPS, was born to make that plan work. New to the insurance business, WPS wasn't bound by common practices or the status quo. Like the new kid in the neighborhood who disrupts social norms, we were free to invent an industry we had just joined. And so it was in the 1950s when WPS developed a brand new approach to claims reimbursement, one that sped up the process, made insurance easier to use and understand, and ultimately reduced the cost of care. Usual, customary, and reasonable, or UCR, started with us and would soon become the national standard for all health insurance companies. Suddenly, folks were starting to notice this new Wisconsin upstart that was bent on rewriting the rules in the best interests of its customers. Soon, we recognized another growing group of Americans who were being largely neglected by the health insurance market. Like today, most folks were getting their health insurance through the workplace, but upon retirement, senior citizens were left unprotected and vulnerable to rising healthcare costs. So 6 full years before Medicare becomes law, WPS designs the Century Plan just for retirees. It covers medical, hospital, surgical, and nursing home care without invasive physical exams. If necessity is the mother of invention, WPS demonstrates its inventive nature yet again. In 1965, the federal government caught up with us, and President Johnson signed Medicare into law. As you might expect, WPS is the first to pay Medicare claims in the state of Wisconsin. But true to our pioneering spirit, we go an important step further. WPS introduces Medicare Plus, our first Medicare supplement plan, designed to help fill the coverage gaps left by the new national benefit. WPS captures the attention of the national insurance market again. Inspired and emboldened by overwhelming customer satisfaction, we continue to move the goalpost. First, with a reshaping of the group insurance market in 1972, as WPS introduces the Health Maintenance Program for employers. Then, with an expansion of the Champus Plan. Then a customer-guided makeover for our Medicare Supplement Plan in 1981, and more Champus expansion throughout the 80s. And then we paused, ever so briefly, to celebrate our 50th birthday in 1996, reflecting on 5 decades of status quo-busting innovation that had made life better for our military, employers, and senior citizens. Our reputation for fresh ideas and customer service was getting stronger by the minute, and it was being noticed far beyond the friendly confines of the Badger State. Soon, we'd be asked to administer Medicare Part B in neighboring states. And you can probably guess who was first in line when Medicare Part D was introduced in 2003. Today, we've created a dedicated team of experts who enjoy providing personalized and attentive service to back up our innovative Medicare supplement plans. They may not be the same team that started supporting seniors 50 years ago, but they are equally as passionate about creating a hassle-free experience for our customers.
It's just always a good relationship. The best thing, it's just good customer service. It's made me a customer for life, I can guarantee you that.
I'm so very, very grateful to WPS, and I would highly recommend anyone being able to get the service that they provide.
There is pride looking back, but there is wonder and excitement in looking ahead. Whatever comes, WPS Health Insurance will remain local, honest, and independent. And whatever comes, we'll remain focused on providing kind, compassionate care to seniors and all those we serve.